Jim, John, we got some interesting topic here, fillers. I remember when we were just sticking it in nasolabial folds, but now people are using it for all kinds of things. It doesn't grow hair yet. I know the three of us could definitely benefit from that.
Darn.
But fillers are touted as doing so many things in the face. So let's talk about some of the more recent things that fillers are being used for and whether or not it's really a good idea.
Well, you're absolutely right. I mean, we've gone from where it was just about filling in the crease to more and more thinking about creating three-dimensional form. And when done by a very skilled person, I think they can be useful, particularly in the cheek if it's done discreetly, sometimes in the chin, sometimes at the angle of the mandible. Sometimes people are putting them in a more superficial plane, just under the skin, and trying to create a jawline. I think that's a problematic thing. I think it often looks weird. And I think we're seeing a lot of overdone fillers right now too. Very strange faces. The fillers get so heavy the face doesn't move correctly, and they really make people look less like themselves.
Jim, talk to me about the type of fillers you prefer. Do you like the ones that last like a year or so, like the Juvederm, or have you tried some of the more semi-permanent ones like Bellafill that last 5 years, and whether you think that's a good idea for doing some of these reshaping?
You know, I think John made a few good points, and I'd like to amplify them. Fillers are things that we can obtain off the shelf to add volume and contour to the face. And they have their place. In other words, I think that, for example, if you want to create a more sculpted look, fillers can achieve that very nicely. And it's not the same as perhaps you would look with something else, because they're not like something else. And what's that something else? Fat. So ordinarily humans don't have a filler in their face, they have fat in their face, and it's more typical of a youthful face. Therefore, fillers can be used to volumize the face, but in a different way than a face appeared when the person was younger. To John's point, it looks kind of weird if you put too much in a face, particularly in a young face, which may already have quite a lot of fat. So I think there's a place for fillers, and you've asked me about the kinds of fillers we use. Generally speaking, I don't want something that's going to stick around for 5 years. Why is that? Because what if I don't like it? What if I put it in the face and all of a sudden, I think that it was good at this age, but now I'm 3 years older than that, maybe it's not so good anymore.
What about potential complications? Some of these things, the liquid rhinoplasty and some of the other injections. Talk to me about some of the potential problems that could occur with certain fillers when injected possibly in the wrong place.
I think you have to be aware. I mean, every zone of the face has the potential for trouble, but certain ones are more scary than others for reasons of blood supply and other issues. I think the nose would be number one on my list, and unfortunately the area just above the nose, the frown area between the brow, you know, if you look at the statistics on where a lot of the real serious trouble has come, it's been in that area, but not just there by any means.
So we'd make the following points. Number one, you have to know what beautiful is. Number two, you have to know how to get to beautiful. And number three, you got to know who you're going to. And going to a plastic surgeon, such as one of us, is going to an expert, and an expert brings with it safety, security, and good results.